Hormones, hormones, hormones. We talk about hormones all the time. Hormones is what people think of when they think of moody women and hot flashes and overweight and gain and all that. Today, we're going to be talking about hormones in the later stages of a woman's life, in the menopause, and the idea of bioidentical hormones and risks and safety and when they should be used and how they can change people's lives. Welcome back to Metabolic Health Solutions, where we guide health practitioners and health seekers alike to find metabolic balance and balance their hormones and get their energy back and have a life that they love living. I have the pleasure of being together today with Lorraine Maita, an MD who specializes in helping people ditch the weight gain, fatigue, brain fog, mood swings, and hormone havoc and have boundless energy, stable moods, a lean body, a sharp, clear mind, and balanced hormones. Sound like something you have somebody in your life that needs? Some of your clients, sometimes yourself. She helps people to understand how lifestyle choices impact mind and body so her patients can choose to feel great. Choose to feel great. We talk about that all the time, helping our patients and clients to be able to choose how they feel by making the right diet and lifestyle choices. She's a triple board certified and award winning physician, a writer, an author, and speaker. And her own struggles with hormone imbalance prompted her to become board certified in anti aging, regenerative and functional medicine, and advanced endocrinology. Her programs impact over 120,000 people in each of three Fortune 100 companies where she served as chief medical officer. She's passionate. Her passion shines through as you start to hear her speak about helping women in this stage of life, and want to continue to live life to their fullest. So she's CEO and founder of the Feel Good Again Institute, Vibrance for Life, How to Live Younger, and has been featured in lots of different media, ABC News, Forbes, WOR Radio, and a lot of outlets to spread the words to help people to live younger and healthier at any age. So welcome, Dr. Lorraine. Is that okay to call you Dr. Lorraine, Dr. May?
Absolutely, absolutely. I'm so excited to be here because hormones are my passion.
I know, I got that when we
Yeah.
talked before. It's like, yeah, I love it. So why? Why are hormones such a passion for you?
Well, I had a very terrible perimenopause. I was tired, I was gaining weight, I was having rashes, I had brain fog, I was moody, moody, moody,
Mm,
moody. So, when my best friend told me my personality changed, and when I walk into a room
mm,
and my staff would be like, "Okay, uh, where she's in there. Should I tuck into the office? What kind of mood is she in?" Right? It was very hurtful. I didn't, I'm a nice person. I didn't want people to think of me that way. And also when I was new and I was working for a big company, just coming out of working in the emergency room in New York City, I had a woman come down to me, and that was back in the day where there were hardly any women executives. I mean, you could
mm.
count on one hand how many there were in this big, big company. So this powerful woman comes down to me, and I'm a newbie, and she said to me, "You gotta help me. I'm giving a speech. And then all of a sudden I broke out in a hot flash. I was dripping with sweat.
Mm,
I lost my words. I lost my train of thought. Some men were looking down and I can't look at this. Others were elbowing each other like, ha ha ha, snickering. And she said, "You've got to help me." And that was like, oh my God, this is my job. I don't know anything about hormones. And I had to learn quickly.
wow.
So fast forward, when I got into perimenopause, it was a little bit different, but whoa, it's a wild ride for some.
It's a wild ride for some, right? And a couple of things I like to ask about that. Why is it a wild ride for some and why do some people sail through it? Like menopause for me was like I didn't have periods anymore. Period. Done. End of story, right? It just nothing. So, except for periods got longer and longer and longer, and it was erratic for a year, but it was fine. And other people have a ridiculous job of it, this woman that you're talking about. So, what makes that difference going into menopause?
We really don't know because, I'd like to say, oh, it's lifestyle, but I taught health and wellness, right? So I was eating right, I was exercising, but then I couldn't sleep and I was gaining weight, and nothing that used to work worked.
Mm,
So I get a lot of women who say they come to me crying. They say, I don't know what's happening to me, and I'm doing everything right, but how could everything be turning out wrong? And I know from my own personal experience, I believe them. Yes,
Yeah.
some people have a terrible lifestyle, like things that cause, most people associate menopause with hot flashes. Things that make hot flashes worse are sugar, alcohol, smoking, high saturated fat diet, and anxiety, right? So
Mhm.
maybe it was anxiety. I had a huge position, 120,000 people, 35 sites across the country, a large staff. So yes, when I went through it, did I have
Yeah.
stress? Yes. So I don't really know if that's it, but I do know that those things make menopause worse
Yeah.
and underlying conditions as well.
Right. Underlying like autoimmune diseases. I know with Hashimoto's, it's worse, insulin resistance or
Yeah,
pre-insulin resistance, blood sugar imbalances, all those things make it worse. Yeah.
absolutely.
And our jobs as practitioners is to really do the detective work and dig in and ask the questions that help us to see what are the stressors that are getting in the way, what are the imbalances, and then how do we correct it, right? And so a lot of people, a lot of well-meaning medical practitioners will jump right in and just well, let's put them on hormones, and not even bioidentical necessarily in the major mainstream medical world, but but where is that place? Like, how do we know when and how to recommend? Now, some of us don't have licenses to prescribe it, so we'd
Yeah.
have to recommend them to a prescriber. But like, why is it so confusing, right? Why is it so confusing? And why is there so much like hormone balancing, right? Oh my, the nurses study and this and that and the other thing, right? We shouldn't be replacing hormones. Just let women suffer, just whatever. Where does all that confusion come from?
Well, a lot of that confusion comes from the old Women's Health Initiative. Now, I've lived through all of this. I'm much older than you think. So I was around when it was absolute malpractice not to give women hormones, and they were synthetic hormones,
Yeah.
Premarin and Provera, and the Women's Health Initiative used a combination of those 2 hormones, and it was called Prempro. So they wanted to see if, they wanted to see whether or not it could help with cardiovascular health. So these were high doses of oral synthetic hormones given to women whose average age was 63, 10 years past menopause. But, by then the ship has sailed. A lot of bodily changes have happened, and given an oral estrogen causes clots.
Mhm.
So the clots break off and go, if they go to your brain, you have a stroke. If they go to your heart, you have a heart attack. We know that oral estrogen does that. We also know that synthetic progestins negate most of the positive effects of estrogen, right? So they stopped the study saying, oh my God, it increases heart attacks and stroke. And then the press got a hold of it before they had peer review and they could put it a context around
Mhm.
it so that the genie was let out of the bottle. This was misinformation at its best. And then they said, oh my God, it increases breast cancer risk. And that was it. Women went off their hormones and people were afraid to prescribe them. So we learned a lot since then. If you give estrogen through the skin, it does not cause clots. There
Mm.
is no risk of cardiovascular disease. There is the synthetic progestins increase the risk of breast cancer. Natural bioidentical progesterone does not. They found it's safer. So this has taken, even now when they have many, many studies showing this, people still don't get it, and this is my passion to educate people because women are feeling not like themselves. They're irritable. Look, it was almost ruining my relationships, my job, my
Mm.
relationships with my staff, my relationships with my friends, my relationship with myself. So I know I needed to do something, but I really wasn't sure what. And we I mean, there are so many symptoms. Just like you said, you didn't have hot flashes, right? Your period stopped and that was it. But women can experience up to 35 symptoms, and they can experience it in perimenopause, which is 10 years
10
before
years, yeah.
menopause. All the symptoms are the same except perimenopause, you get your period. It could be irregular, it could
Yeah.
be heavy, it could be light, you could skip it, you could get it more often, but these wreak havoc with your health and your moods. And some women get gas and bloating because hormones change your microbiome or the lack of. Hormones fluctuate all over the place, so that can cause mood swings, and also sleep disorders, which make you tired, it makes you irritable, it makes gives you brain fog. You can get a lot of aches and pains. Some people, get the onset of different autoimmune diseases. I say you get autoimmune diseases during the 4 Ps: puberty, postpartum, perimenopause, and postmenopause. This is when hormones fluctuate, your immune system goes a little nuts, and that's
Mhm.
when autoimmune disease develops because generally during those times you have some kind of stress, and maybe if you get an infection, that is ripe for autoimmune disorders, right? So some women get those. They might get aches and pains or dry mouth and dry eyes and painful sex and urinary tract infections, palpitations. So there are about 35 symptoms, and women go from doctor to doctor and they all tell them, you're getting old or you're stressed or this is just normal. Here's this pill. Well, you know what? That doesn't solve the root cause,
No.
right?
No, because
And
they're just symptoms, right?
right,
And maybe they do a lab test and say, "Oh, your estrogen's low," or whatever, and they do try to get but it's not a comprehensive approach either, right? It's not a diet, lifestyle, stress management, sleep
right.
management's approach, which is important. And in terms of those 35 symptoms, I think if you're a practitioner and you're working with that population of people, you need to know what those symptoms are, whether you create yourself a questionnaire to have people fill out, but just to see because a lot of times somebody may come in and they're like 38 years old and you're not thinking menopause or 35 years old even you're not thinking menopause,
Oh, not at
right?
all.
Not at all, but it could be they're having a transition into the premenopausal period, right?
I see premature ovarian failure much more often now, and I think it has a lot to do with the toxins.
The
This
environment, right?
right. So this my approach is, okay, be suspicious of hormones, but just don't slap hormones on somebody. Prepare their body for hormones because I found that the biggest issues that people have if they don't respond well to hormones is they're constipated,
Mm,
they, have too many toxins, they have gut dysbiosis, and their cortisol is off, right? S
right.
Or they have a problem with their gallbladder.
Yeah.
So,
Or their
those are
blood sugar.
oh, their blood sugar, yes, and that's really cortisol, blood sugar, they dance with each other, and blood sugar issues are huge. So I always start people like, "Okay, I'm gonna measure," and if they're, still having a period, I have them measure it day 19 to 22 for a 28-day cycle, 16 to 19 at a shorter cycle. If they don't know when their cycles are going to occur, I will have them measure at when they're feeling the PMS symptoms, or because perimenopause and PMS are 2 sides of the same coin, or if they're menopausal and haven't had a period in a year, you can measure any time. But if they're not having periods, their periods are irregular. I mean, I went 10 and a half months and then I got one, right? So
I did the same. It was 11, almost 12 months, and I'm thinking, "Yay, menopau"
me
and I'm
too,
like,
me too.
"Oh."
Oh, yeah,
Yeah,
yeah, and
yeah, last hurrah. So, when you measure, though, how are you measuring? There's a lot of controversy and disagreement over what's the best way to measure hormones.
sure. Well, when I first measure, I measure in blood.
Mhm.
And I tell my this is how I talk to my patients about it. When I put you on hormones, I want a 3D approach. I want to see where the hormones are going and what your body is doing with them. So the first time I measure in blood to see if there's any estrogen, if there's any progesterone, because believe it or not, some menopausal women are making sufficient estrogen and they're not making any progesterone.
Progesterone, yep.
So then I'll just start them with progesterone, and it could be anywhere from several weeks to several months to several years where they're gonna need estrogen. So the thing is you have to watch them and you have to educate them about what the symptoms are of high estrogen, low estrogen, and high progesterone. So when I put somebody on the hormones and they have a sufficient amount of estrogen and progesterone, I will measure blood and saliva simultaneously at the
Mm,
same day, pretty close to the same time,
right.
because I compare and blood is like your bank account. It's free to save or spend, right? And it measures free hormone and bound hormone. Only free hormone gets in the cells. So some women are savers. They shuttle it into the tissues. They have a lot of free hormone, goes into the cells, does its thing. Some women don't let go of it. So the saliva will measure the free hormones, and, ZRT Labs is the one I use because they actually did studies where they measured the amount of hormone in saliva, and they did uterine biopsies. God bless those women who volunteered for that, and they matched, here's what's in the endometrial tissue, and here's what's in the saliva.
Oh,
So they
nice.
have a good way of measuring it. So then I can get a sense of where are the hormones going. So blood and saliva first, and then I'll do the Dutch test. So the Dutch test, the way I explain it to my patients, I mean, most of you will probably know a lot about this, but I explain it to my patients is you're going to still women, even non-menopausal women, are gonna make estrogen in their fat and adrenal glands, but that's not the nice estrogen. That's estrone. That is inflammatory, and that can change and proliferate in breast tissue, and women with a lot of estrone have a higher risk of cancer, and if they have cancer, they have a higher risk of metastases. But we give estradiol, and estradiol, so that's E1 estrone, it has the name 1 in it. Estradiol, di means 2, is the hormone that we give women for preserving bone, brain, and cardiovascular system. So your liver is going to take all the different estrogens, and there's E3, which is estriol, tri. Now that has receptors in the skin and mucous membrane. So sometimes when estradiol doesn't convert into estriol, I will give that women estriol in their vagina, and it helps with dryness, right?
Right.
And it helps with urinary tract
Right.
infections. So then your liver takes all these estrogens and it's going to break it down one of three ways. 2-hydroxyestrogen, which is kind of benign, but it's like clean recyclable garbage, right? It's still garbage. Uh 16-hydroxyestrogen, it's sort of like it's not it's toxic, but it's not as toxic as the 4-hydroxyestrogen.
Right.
So the Dutch test is going to tell us how much of each of these you have. You're always going to have some. And if you're making too much of some of the toxic forms, I give certain supplements. Like if it's 16, I give resveratrol. If it's 4, I give indole 3 carbinol, or I mean, I like Zymogen Xenoprotix because it works on all the different enzymes to make more of the benign and less of the toxic. And then just like any garbage, it needs to be packaged properly for the body to dispose of it. So we want to look at the methylation. And the Dutch test will tell us that. Because if you don't methylate, you're just reabsorbing those metabolites, whether they're toxic or non-toxic.
Mhm.
So that's how and then I'll measure. So if you measure the Dutch test when their estrogen levels are low, it's not going to be accurate.
Mhm.
So I measure the Dutch with the blood so I can compare. And then I have a good 3D view of how they process their hormones, where they're going, and how to fix any of these metabolic pathways.
Yeah, yeah, and I like that you're looking at the pathways because that's what I teach my practitioners as
Great.
well, that we
Yeah.
need to look at the pathways. So kind of a couple of questions that come up from that, right? So 16, when it's like that has a double-edged sword. When I see it going too low, I'm concerned about bone health.
Yes.
So let's talk about that a little bit and what we could do if you see what do you do if you see that?
Well, I still I don't do as much for low 16 as I do for high 16.
Mhm.
I sometimes can raise the estrogen, and I'll look at the end results. If they have bone loss, I'll raise the estrogen. And if they I look at the end results and the endpoints. So measuring 16, there are ways to increase it, but sometimes the ways of increasing 16 increases the 4. So both of them are somewhat toxic. So I leave it alone as low, and I do absolutely everything to fix bone, like alkalinize. Right, and to, have good absorption, digestion, elimination, adequate estrogen, adequate vitamin D and K2 is
Mhm.
MK7, and I also use orthosalicylic acid it helps with collagen production for bone, so
Okay. I
it's
orthosalicylic acid, that's a new one for
yes.
me.
Yeah, and it helps with skin, hair, bone, and nails.
So I want to ask you another one. My understanding, and when I look at the biochemical pathways, is that estriol is more likely. Estrone can convert to 16, but the estriol has a stronger conversion into 16. So oftentimes, if I see the 16 being low, then I'll supplement with recommend that they supplement with the estriol to bring that back up. And also, iodine helps that conversion.
Oh, that I didn't know. That's great.
Yeah.
It's great. Yeah, so a lot of times my women want the estriol facial serums. So that helps, right?
Hmm.
And when they have dry vagina or any dryness or frequent urinary tract infections, I have a compounding pharmacy make estriol vaginal.
Mm.
It has to be made at a compounding pharmacy, so that does help. Yes, and not every woman will convert estradiol to estriol because some women will say, "Well, how come I'm still dry if I'm on estrogen?" Well, it's the pathway, it's
It's the
not
pathways, right? When so much of what we can advise for people is it's just sitting there. If you look at the biochemical pathways, these are my biochemical
Oh, yeah.
pathway charts that I keep handy of everything, because if you're like, why isn't that converting? What else is involved? What nutrients are involved? What genetic variants may they have that's slowing that down? So there's just a lot to consider. Right? There's the basic, and then there's a lot to consider. But the other question that I had was, when you said you start with the blood, and then you'll supplement the estrogen from the blood, or you're prescribed from the blood, or do you wait for the other?
First, the f I well, first of all, if they have symptoms and the blood shows low estrogen, the low estrogen, and I look at FSH and LH, so if they're above 23 or 28,
Right, that they're
they're
obviously in
and they
menopause.
have low estrogen. That doesn't mean they might not get a surge. Some women all of a sudden will get a surge, and it's like, "Oh, what just happened here?" Yeah, and
Yes,
it comes out of nowhere, but for the most part, if their estrogen is low and they're symptomatic and they have a high FSH and LH and they haven't had a period, you know that. And even if their estrogen is low, you have to and they could be perimenopausal, you make them comfortable and you just warn them, and then, like, if they start feeling PMSy, that's what the signs of estrogen dominance
yeah.
is: anxiety, irritability, impatience, insomnia, growth of the breast, cyst of the breast, tender breast, bleeding, spotting, weight gain, especially the breast, hips, and thighs, or, all these mood swings. So if they have those symptoms, I'll tell them just I usually start with an estrogen patch because it's covered by insurance, and I have them take the patch off, let the symptoms go down, and then go back on it because they
You
could have been a surge.
Okay, and you can get a pot the patches are bioidentical, not
Yeah,
synthetic?
yeah.
Okay, well,
Yeah,
that's good to know.
pharmaceutical companies make bioidentical estrogen, they make it in a patch or a gel,
Okay,
and that's why sometimes, people have to pay out of pocket for any of the compounds.
right.
So that's why, like, I don't always jump on giving estriol because it's like, "Oh, I don't wanna pay more money." So, we just see, like, if they need it, I give it to them, and if they don't wanna have it, well, then they don't wanna
Then they don't wanna have it, right,
right. They love
absolutely.
the facial serum.
Okay.
They
You
do.
know where people are, and I see it too. The priority is how they look, not so
Yeah,
much how their
yeah,
body's functioning, and we sometimes have to have a come to Jesus moment and say,
yeah,
"Look,"
yeah.
um, but okay, so that is the other question is there a concern if they are low and you haven't done like a Dutch, so you don't know how they're metabolizing, that if you give them estrogen, that you have a concern that they may convert it more to the 4-hydroxy, or is that why you're following it up with the
That's why I'm
Dutch?
following it up.
Okay,
Only because you know what? It people come to me sometimes on so many different supplements, and they don't even know why they're on them, and I wanna my job is not to give them as many supplements as possible and be the difference. Like the functional medicine approach is give everybody a supplement for every symptom rather than a drug for every symptom. No, no. It's figuring out what do you need. And that's what I
Exactly.
tell them. We save you time and money because you know what? All those other years that they were having periods, they weren't on these supplements, right? They weren't on these supplements, but I detox everybody first.
Okay, so tell me more about that. What does that mean?
So the way I do a detox and elimination diet, and I tell them it's to prepare your body for hormones. And I use that as a litmus test because after our detoxification and elimination diet, at least 80% of people feel good to great. And then I know if it's just hormones, they go into one program. If they don't feel good to great. There's something deeper. Like they have bad dysbiosis, they have metals, they have mold, they have some other problem like Lyme. So
Mhm.
my detoxification is I will have them do we prepare them to let them know we're going to eliminate 10 foods for 2 weeks. I do a very short one
Mm.
so people are motivated to do it. And I say you could do anything for 2 weeks, right?
Mhm.
And they're like, but
Well,
right,
maybe.
yes,
Right? Yeah, they do.
yeah, and you want to get better, right? I said, "Because I'm not gonna give you hormones unless you do this." And then they're like, "Oh,
Okay.
all right, I'll do
Okay.
it." Right? So I
Yeah.
eliminate alcohol, artificial sweeteners, caffeine, corn, dairy, eggs, peanuts, soy, sugar, and anything with gluten in it. So while they're doing that, they're eating paleo style if they want to lose weight. And if they don't want to lose weight, they can have gluten-free grains and starchy vegetables. If they want to lose weight, they have non-starchy vegetables.
Mhm.
And then I give a shake that has some sort of a medical shake that has anti-inflammatory properties that heal the gut and decrease inflammation. And I give sort of a liver herb formula to detoxify the liver. So because all of that, like the foods can cause inflammation, the toxins can cause the
Yeah.
inflammation, and all the gut dysbiosis can cause inflammation. And you can have some changes in your gut microbiome pretty quickly. Not to say that they're going to stay unless people,
Unless you maintain it. You have
yeah,
to
they
keep
have to
feeding
maintain
the
it.
good guys and not feeding the bad guys.
Yeah, so the first week they don't feel, "Oh, like, I don't why am I doing this?" It might not feel good, and then the second week, they're like, "Wow, I feel better. My head is clearer, I'm sleeping, I have more energy, my aches and pains are less, I don't have GERD, I don't have gas and bloating," and then we start introducing the foods back in. So, then I know they're prepared for if they need hormones, I know their body is better able to accept hormones. Plus, I have to make sure they're eliminating because constipation is the enemy. This one woman keeps I stress, You gotta move your bowels, right?" And she keeps saying, "Oh, I'm getting breast tender." And then I ask every time, are you moving your bowels? Well, it's not so good, and I'm going through the how to move, you gotta get them moving, right? You gotta get them moving because they're
Right.
just reabsorbing it.
Recycling all the toxins. Yeah.
Yeah, yeah, and the women without gallbladders, they also the bile takes out toxins too. So, I put them on Tudka or bitters or
Yeah.
it depends on their levels of symptoms, but I
Right.
wanna make sure all systems are go.
Right. That makes total sense. So they're not just coming in and you're writing a prescription for bioidentical hormones and sending them on their way.
Yeah,
That you've got to get the body ready and you've got to really balance the underlying root causes. The root cause is not your age because you're going through menopause. There's imbalances because you don't have to go through uncomfortable menopause. It's aging is inevitable, but the suffering through
yes,
aging
it's
is
optional.
not. It's
Right,
optional,
exactly.
right?
Yes, totally
Yeah.
optional,
And
yeah.
that's why figuring out what those reasons are. And so when you see that the hormones do well and you continue, you go, how long before you test the urine and the saliva and the blood again? 3 months or
Yeah,
yeah,
usually at the 2-month mark, it's there because it takes you have to give people at least a 2-week leeway, and it takes at least 2 weeks for the blood test to come back and
yeah,
2 or 3 weeks for the other test to come back. So,
yeah.
the sex hormones reach their peak effect in 2 months. So what you see at that point is what you get. So measuring it sooner than that is really not Y no, it's not gonna be helpful because then you can say, "Oh, you feel good, the levels are good," and then they get the side effects because not everyone fits in the magic numbers, right? They're the magic numbers. Estrogen should be 50 to 100 in blood and progesterone 8 to 10. Well, some women just cannot tolerate the doses, so you have to personalize it.
Exactly, and I'm glad you say that because there's no one size fits all, right? It doesn't work that way, and we have to adapt. And I'm always a fan of when I'm giving anybody anything to take or
Yeah.
supplements or herbs or whatever, it's a slow and slow, just a little
Yes.
bit, a little bit, a little bit. And I also believe in, and I know you can't really necessarily do this with the hormones, but because it's harder to test, but low and slow, right? And
I
then
start low.
minimum effective dose.
Yes, but I start with a basic the lowest dose that comes in. So for some, that's too high, but for most,
Yeah.
they'll let me know, like, I'm still flashing, so I mean, I can't handle this, and I may go up a little sooner, but for the most part, you know, a lot of people do well on the smaller dose. So why?
Yeah.
Because I've had people come to me on mega doses. It blows out your receptors. Then they stop responding and you really need to detox. I mean, I had a
Yes.
woman come to me on a dose of testosterone that a man would be on.
Mm.
And she kept insisting, I'll go, no, no, I feel good. But you know what? When I got her detoxed and got her into reasonable range, she goes, you know what? I really do feel better. Even my husband says I'm not testy anymore.
There you
Yeah,
go. There
yeah,
you go.
yeah.
That's great. That's great. And so you test that way. How often after that? Are you continuing to work with people over the like, you're not just gonna test them at 3 months and say, "Hey, you're fine. Have a good life," or are you continuing to do maintenance and retest?
Yeah, I just continue to maintenance. If somebody wants to work on other things, I'll see them quarterly. If their levels are stable and they're fine and their labs are good and they don't have a lot to work on, then I'll see them twice a year. But I'll
Mhm.
always retest because what you eat, what you drink, how much you sleep, how much you exercise, the stress you're under, the toxins you're exposed to are all going to affect your hormones. And who's steady? Like who has that, right?
Right.
Like something is always changing, right?
Yeah, that's true.
People fall, they break their leg, their parents are ill and they're flying across country, their children are sick and so they're a moving hormones are a moving target. So, but generally, I'll follow people quarterly if they have a lot of other things they want to follow. Some people want to be followed quarterly, but some people that are very steady and I've not had to change the dose and life is good, then twice a year.
Yeah. Yeah. And I think that's a good plan because I think if you just let people go and just keep renewing their prescription, things change. It changes, right? You really have to look at that. And when you go back and retest, you're looking at the 3 compartments, basically? You're
Not
looking at blood.
always, like, I'll figure out, like, this woman only measures well in saliva, or this woman only measures well in blood. Dutch, I'll do again to see, like, if I had to give them supplements to shift from the 4 or 16 to the 2 and the methyl I wanna see that what I gave them was enough. In most cases, it is, but, I'll redo that. And cortisol, I may be testing more often, and that was the other thing I left out. When the cortisol is off, everything else is off because that's gonna make the blood sugar off, and if they go slipping up on their diet and they go on a sugar binge, it's gonna affect them. Because
Right.
this one woman always sends me a portal note. "I had hot flashes last night." Said, "Look, did you have any sugar or alcohol?" "Mm, yeah." I think that's what it is. Let's not change anything now, right?
Right,
So,
right.
you have to constantly be vigilant because as many times as you try to drill it in, people are people, and we're all gonna like rubber bands. We're gonna kind of go back into those old habits.
Yeah, yeah,
Yeah,
yeah. So, we've talked a bunch about how you do it and the risk. What's the risk of, like, just living with it and not doing it other than being
right.
miserable?
One thing I want to make it pretty clear is so many women come to me and they say, "Oh, I just have hot flashes. They'll go away. It's nothing." Now, hot flashes are like your check engine light. They show that there's something serious going on. You're either losing bone, your cardiovascular system is running awry, or it's a risk factor for inflammation and dementia. So the all 4 of those are major risk factors, but I tell people, what is the quality of your life? Are you because I know when I was going through perimenopause, I lost my self-confidence, I lost my self-esteem, I lost my zest for life, I was losing my hair, I was not sleeping, I was irritable, so even though I chose the right words and did the right things, it would come out it irritated, and it wasn't directed at them, but people felt it, and people were like, "Oh, oh, what did she just say?" Right? So, it affects your relationship, it affects your productivity, it could affect your job performance, but it affects your relationships to yourself and all those 35 symptoms of menopause. So, some women go on all these medications for different things, and you know what? If they would have taken care of it.
Well, yeah. I mean, if you're going to go on medications for the symptoms,
Yeah,
why not go on
right,
something for the cause, right? Like for
right.
me, I've never taken any hormones. I never had symptoms. I feel great all the time. I have lots of energy. I haven't gained weight. Why do I need them? Maybe the tests show they're a little, but they show that they're at the middle to lower end of perimenopausal range. I don't need my hormones to be in premenopausal range, right, in order to feel good.
So if you have a family history of dementia, osteoporosis, heart disease, maybe it's something you should look into. And, and in some women, that's the deciding factor. Like
Yeah.
their cholesterol starts to go up or they're losing bone. And I'll start to do DEXA bone scans in perimenopause because
Hmm.
you start to lose most of your bone actually in perimenopause. You
Yeah.
lose 80% of your bone in
In
perimenopause.
perimenopause. Okay, so do you see if somebody comes in and they've had a DEXA scan and say they're a -2 or whatever, and you get them on bioidentical hormones, will you see that improve?
Yes, but they have to do all the other
With
things.
all the other things, right, with the
Yeah,
diet and the lifestyle and the avoidance and the
yeah,
detox.
'cause some women
Yeah,
are like, "I exercise, I'm on hormones, and, why do I have osteoporosis?" Well, you're acidic, you're having too much sugar, you have
yeah,
inflammation, you're taking care of your gut health, you're not doing the right kinda exercise,
right.
and it's like I tell people, it's like baking a cake. You leave even one ingredient out, and it's a flop.
Bingo. Yeah. Yeah,
Yeah.
absolutely, absolutely. So who should not go on bioidentical hormone therapy?
Well, I mean, the thinking on this is changing, but I'm too chicken to give anybody hormones who has breast cancer or a history of breast cancer. Because that sounds I don't experiment on people. I study something really well and thorough before I'm going to do something about it, right?
Yeah,
And I
yeah.
don't study cancer and I don't take care of patients with cancer. I take care of them after cancer, after they've had their treatment. But breast cancer, some doctors are comfortable with that. And if you're really suffering, I would consider going to somebody who really knows that, right? Breast cancer, the BRCA gene, or if you've had like a deep vein thrombosis or a pulmonary embolism. Because if you had the tendency of forming clots, on hormones or off hormones, you're going to form clots and everybody's going to blame it on the hormones. And you'll always say, oh, it was because of the hormones. And even though we know estrogen through the skin doesn't cause clots, but if you have a genetic predisposition to clotting, a pulmonary embolism can kill you instantly. So I don't mess with that. But those are very
Rare.
few,
Yeah.
few and far between. And the benefits, the North American Menopause Society and 20 other organizations say the benefits outweigh the risk because you decrease osteoporosis. There is no increased risk of breast cancer. And I won't go into all the statistics and how they analyzed it, but estrogen does not cause breast cancer. I can't say it enough, and there are plenty of studies, and that it protects you from several gastrointestinal cancers too.
Great. Well, that's good to know, and it's topical, just going back to really we don't wanna do it orally. Is there a mechanism that's been identified for why orally
Yes.
creates problems.
Yes, first pass through the liver. The liver, when it goes filters through the liver, when you swallow it, it goes first pass through the liver. The liver forms clotting factors.
Okay,
Now,
got it.
as progesterone you can give orally, and the natural bioidentical and pharmaceutical companies make micronized progesterone. That's natural bioidentical, and it's found to be safer. It does not increase coronary artery spasm. It doesn't give you gallbladder trouble. It doesn't give you clots. It doesn't give you diabetes or high blood pressure. It doesn't negate the positive effects of estrogen because synthetic progestins like the Provera and the Prempro and even the birth control pills. Sorry, you know what? No one bats an eye about giving anybody birth control pills, and it's come out now. All those implantable birth controls or the long term, they're all showing an increased risk of breast cancer.
Yeah, implantable. You led me to my last question that I wanted to ask you. What's your thoughts on the pellets?
Well, I think in the right hands and someone who really, really knows pellets, it probably can be okay. I know but sounds funny, but I prayed for guidance. I was ready to do pellets. I prayed for guidance. Should I be doing pellets? Within 2 weeks, I had 3 people come to me with severe, severe side effects to the pellets because you can't fix the dose. It's implanted in you. One woman wanted to kill her baby. Why somebody gave her testosterone pellets postpartum is beyond me. She was so angry
Oh,
and, she just was she didn't know what to do and she felt terrible about it, right?
oh
And then
man.
another woman was just the irritability and the testiness in her, she just couldn't handle that anxiety and it's like an agitation and an anger. And then a third person, same thing. So it takes a long time for that to wear down, and I had to, like, detox them and do things to calm them. So that was my answer, I'm not doing pellets, right?
Yeah,
So once I
yeah.
saw I'm a control freak anyway, so even
Right.
progesterone, I like to know, "Oh, okay, somebody sends me a note, this is how stop this, stop," so and I separate them out, like, somebody will give, like, all 3 hormones in a cream, and it's like, the creams, by the way, estrogen cream and progesterone cream, you cannot measure in blood. They don't measure in blood.
They don't how do you mean? What do you mean they don't
They
measure in
just
blood?
don't they go straight into the capillaries, and they don't really measure properly. So you have to measure in saliva.
Okay.
And, some states, they don't allow saliva, so it's a problem. I have a lot of New Yorkers. New York doesn't allow saliva tests, so
Even
it's
if it's prescribed by an MD, it's not allowed?
no, no.
Oh, I knew
The
New York was
state
crazy and you can't
No, it's
function.
crazy. New York, New Jersey's crazy. Like, everybody else can get cheap lab tests. We can't because
Yeah, can't.
yeah, Quest and LabCorp have their headquarters here. So, you know what? I think they fixed it so that we
Oh,
can't do that, I
oh
don't know.
my.
That's my theory.
That's your theory.
Theory.
Okay, we'll let that one go. All right.
Yeah.
So we come to thank you so much. This has been very enlightening. I really appreciate it. Is there anything we didn't cover that we should have covered that you'd like people to know?
No, I think we covered the most things, but that's why I offer a lot of courses. And
Okay.
the course that you most likely would be interested to help to give you a framework in which to talk to patients about that would be is hormone replacement for therapy for you. So it gives you questionnaires to ask the patient like what are your personal
Mm,
risk factors, what's your family history, what's the risk of taking estrogen, what's the risk of not taking estrogen, what's your quality of life that estrogen can help, what are your symptoms that estrogen can help. And then I give you all the studies so that people can make an informed decision and you can actually guide your patients because no matter what, they're gonna get pushback from their family, their friends, their health practitioners, and then when they show them, "Here's studies, and these are recent studies, and these are valid studies from mainstream medical journals, from big name teaching hospitals, from MDs that actually show it's safe," right? So
great.
there's a synopsis of all the studies and then the abstracts, and then the part 2 of the course is what people can expect if they go on hormones. So that's been very, very helpful for many people that don't have a prescriber to walk them through it. And then those who just want to know how hormones interact with each other, I have the ultimate hormone reset that gives you, it's more of a from a patient's perspective, but there's always pearls in there: estrogen, progesterone, thyroid, and cortisol, because they all interact
Yeah,
with
they
each
all.
other. And there's a lot of misconceptions about, if you don't have a uterus, you don't need progesterone. No, wherever you have an estrogen receptor, you have a progesterone receptor. So you need it for your brain, your bones, your heart, your skin, your kidneys, your urethra. You need it for everything. So those are, I think, very, very helpful courses. I've gotten great feedback on them, and they're pretty thorough. And the other thing I didn't stress was measure cortisol, because if that's
Absolutely.
off, everything else is off. And most of the time a lot of times when people do the detoxification and elimination and you get their cortisol balanced, they don't need hormones.
Mhm.
Yeah.
Yeah. Yeah,
Yeah.
that's great. That's awesome. We'll have all of the links to that. Your the Feel Good Again Institute.com is your main website.
Main website is for the courses and coaching, and for medical practice, it's Vibrance for Life. And I'm only licensed in New York, New Jersey, Pennsylvania, and Florida, but
Okay.
soon to be licensed in Arizona. I have a lot of
Okay.
snowbirds.
Woohoo. Okay, great. That's great. That's great. Okay, and we'll put the links to that, and if you can give us the links directly to the courses too, we can put that in the show notes in the description so people can access it. This has been a wealth of information, so I really appreciate your approach and your approach to the testing, the thorough testing, the retesting, but to getting people prepared for it. It's not
Yeah.
just a matter of taking hormones. And I appreciated your comment about a lot of functional medicine practitioners just prescribe supplements instead of drugs. And that's not functional medicine.
No.
We want to really help people and empower people to take charge of their own health and to make decisions. And every choice matters, right? Every choice people make, like where they're going to watch TV or go for a walk or meditate or what they're going to eat or they're going to sit around drinking alcohol at night, all of those things matter in the health. Right? And we have to address those things as much as people don't necessarily want to hear that. That's the basis of health, and the hormones are just icing on the cake to help us when our body is no longer doing what it should be doing. And the last oh, I forgot to even ask you this one, how long do people generally take HRT? I've heard, like, take it for 3 years, and then usually that the balances after that, you don't need it. What's your experience been with that?
Can take it as long as you want to. A lot of women say when they retire that, it's not covered by Medicare. So they're like, okay, I'm retired. I don't have to be at the top of my game. I'm tired of going for follow-up, and I don't want to pay out of pocket. So some of them go off. And then I'd say 60% wanna go back on them. And then I have women in their 80s, they're like, Don't ever, ever take me off hormones. No." And, and the other thing I didn't mention is that it's safe to take it over the age of 60. It's best if you take it within 10 years of menopause under the age of 60, but there's no contraindication to giving it to an older woman, and there is no cutoff date. As long as you monitor, your breast health and bone health and other things, you have to be sure they're not doing any harm anywhere, and there's no reason to go off them. I'm never going off of them.
Okay, good for you. So when you find something that makes you feel good, you do it as keeping you healthy. So thank you again for being here. Be sure to check out Dr. Lorraine's The Feel Good Institute, and all the links will be in the show notes. Thank you all for being listeners and for being here and for being dedicated to being the best practitioners you can be and for helping people to truly get to the root cause of illness and not just cover up symptoms and help people to live their vibrant life for as long as they live, right? Good, healthy, happy, and choose no matter what their age. So I really appreciate that. Listen to our past episodes, lots of great content here to help you be the best practitioner you can be. Or if you're here for yourself, to be as healthy as you can and empowered as you can to take charge of your own health. So check out the resources, check out our other videos. For more information about metabolic health and insulin resistance, click on this video over here. And don't forget to like and subscribe and share this video to keep up to date on the latest in metabolic health solutions.